28-year-old Aubrianne Moore killed her 3 children you see there, Kyrie Rotary, Cassidy Rotary, and Elena Rao, before Moore took her own life. And court documents are revealing that Moore had been diagnosed with unspecified schizophrenia back in September, saying that she was a potential threat to herself or others and that she didn't understand a need for treatment. Well, now Fox 17 is looking into where people with mental illnesses can go to get help in West Michigan. Michael Dupre joins us live with details on the options available here in Kent County. Michael.
Yeah, Audra, experts will tell you that identifying and treating a mental health patient isn't often an easy task. Each individual patient is unique, making the process of a diagnosis and treatment both complex and time-consuming. And while finding professional help is the first step, some people who need it the most don't want it.
It's like somebody came and shut the lights off in that room, and now you're sitting in the dark.
Struggling with mental health can feel overwhelming. And even once you decide that you need help, finding the right help is often easier said than done.
There are challenges around where's the right place to go. So I think it's really figuring out how in this community do we help people navigate to the services that they need.
Mental health facilities like Pine Rest offer a wide range of services from inpatient to residential care. But another concern for anyone seeking help can be insurance and cost of care.
If you have any kind of a commercial insurance or a Medicare product, you can pretty much go and access services anywhere they exist. If you're uninsured or you have Medicaid, your authorization really has to happen through the community health agency in your county.
That community health agency in Kent County is Network 180.
I think that our CMHs do a great job of kind of referring people to the right level of care. Social worker will meet with them, will assess, will kind of determine with them what level of care, we talk about levels of care, they really need to meet the needs that they have.
An initial assessment, another step towards help for those seeking treatment. But it's a different scenario for those who don't want or can't recognize the need for help.
So about 35% of our inpatient hospital admissions are actually what we call involuntary admissions. Typically those happen when someone sees a person who is at risk of harming themselves or harming someone else, but they don't see it and they don't want treatment.
A family member or loved one can file a petition saying that person needs services, or the community health agency can file it with the court.
One of the things in the state of Michigan that we do is that we basically give hospitals the ability to hold people up to 3 days.
How long someone is held inpatient for treatment can be difficult to decide.
If the decision is, yep, this person is not safe or others are not safe as a result of their mental illness, then a physician, actually 2 physicians, eventually have to see them and certify, yes, I agree with that petitioner, and they can be hospitalized.
Doctors doing the assessment will look for warning signs that warrant longer treatment, but must also consider the patient's rights.
So if, for instance, we admit them involuntarily to inpatient, then they are seen by the physician, they're started in treatment. If they continue to object to that treatment, they have the right to a trial within 7 days.
Pine Rest is planning on opening up a psychiatric crisis center coming up sometime in April, and that should give people more immediate access to the care they need.
After a shooting in Kent County that left a mother and her 3 children dead, investigators say Aubrianne Moore killed her daughters Kyrie, Cassidy, and Elena before taking her own life in late February. Court documents reveal she was diagnosed with schizophrenia back in September, and doctors believe she was a potential threat to herself and any others, but they could not force her to stay in that treatment. And now the Kent County Sheriff's Department is speaking with Fox 17 about the obstacles in the mental health system and how they affect her department on a daily basis.
She says more than half of their inmates are diagnosed with some kind of mental illness. Fox 17's Michael Dupre has that story.
Answering 911 calls for help puts officers and first responders face to face with more members of the community than most. Some of them are criminals. And as we're hearing from the sheriff, many of those criminals have mental health complications. And as troubling as that correlation is, the sheriff says another issue is where they can take a suffering individual that can best help them.
The Kent County Correctional Facility is faced with a large number of inmates who may have broke the law, but are also enduring struggles with mental health.
We are faced with upwards of 65% of our incarcerated persons have diagnosed mental health issues. About 10% of them have serious mental health issues.
And jail can be a troubling place for someone suffering mentally.
And they could easily deteriorate while they're incarcerated because it's the exact wrong environment for them.
Sheriff Michelle LaJoy Young says the department does provide care for diagnosed inmates.
Many of them are on medications to try to manage their symptoms, and they'll become stabilized when they're in the correctional facility.
But once they leave,
They decide to stop taking their medications, and then their behavior deteriorates, and again, the cycle starts over again.
the sheriff says it's a revolving door.
Because there's not really a mandate for long-term management of these symptoms, it does speak to that revolving door.
Leading to subsequent arrests without an alternate facility to take them to.
I think there is a gap in that critical initial contact state where you've got somebody that you're dealing with in the community and they really need help right now, and there's not really a qualified place to take them.
The sheriff says an inmate who's jailed because of an assault may be denied access to mental health care facilities due to concerns of aggression. And if a suspect is too violent, emergency rooms won't take them.
If somebody has behavior that's not stable enough to be dropped off at the emergency room, they bring them to jail right now.
The sheriff says more money could help, but it's not the only answer.
Funding is not the only issue, although it's part of it. Community mental health in general has a lack of funding of what they would need to service the entire community.
Some initiatives are underway in Kent County that could improve the situation, like psychiatric crisis centers for immediate care, something the sheriff is a strong supporter of.
That critical incident center would have the right resources to assess and evaluate the person.
And that could go a long way in stopping the revolving door the sheriff sees at the jail.
There are absolutely a portion of the people that we deal with in the correctional facility who are not being well served at all being in a correctional facility, and in fact, a correctional setting can exacerbate the mental health symptoms that they're experiencing.
Sheriff Michelle LaJoy Young says that there are psychiatric crisis centers that will be opening up in the Kent County area that will give the access many people, inmates, and citizens for mental health care. We'll make sure and update you on when and where those facilities will be opening up. Michael Dupre, Fox 17 News.